Thank you, Deputy Speaker. Look, I rise in support of the motion moved by the member for Wakefield. Indeed, as has been mentioned, Palliative Care Week runs from the 24th of this month to the 30th. The theme this year is dying to talk. Talking about dying won't kill you, Deputy Speaker. And indeed, dying is a natural part of life. I think we're all very well aware of that. But it is important that we plan and that we prepare, that we normalise the conversations that occur around end of life. As Palliative Care Australia wants to normalise death and dying, to do this, Australians need to feel more comfortable about talking about what their wishes and needs are as they approach end of life. Australians need to be comfortable and confident to ask for the care that they want, Deputy Speaker. Indeed, and it has been mentioned by those on both sides here about the wonderful work that is going on in a program known as Hospice at Home in my state of Tasmania. This is a program that is coordinated to give better access to palliative care for people, particularly in Tasmania, in what is a very dispersed population outside of Hobart and Launceston. And this system is working particularly well. There are three partners in this program. One is the DHHS, the Department of Health and Human Services, the Tasmanian Association of Hospice and Palliative Care, and the district nurses, as I mentioned, that deliver the clinical side of that. DHHS's role is to provide specialist positions in palliative care and strategy around the implementation. Tasmanian Association of Hospice and Palliative Care, led by Colleen Johnson, indeed, is about education and awareness, also the delivering of advanced care planning. And I just wanted to compliment particularly the work that I've seen on now more than 3 occasions of Anna Spinazzi, who is one of those advocates that works in this space. I've first met her at the CWA meeting, the Brighton Broadmarsh CWA annual general meeting. She was the guest speaker there. She was absolutely outstanding, Deputy Speaker. I met her up at Triabunna at a community discussion around broader social issues in that area. But also she attended what was a fantastic event at the Ellendale Community Hall last Friday week ago, there with a comedy show, if you like, about death, and it really did. It was an engaging way of talking about something that sometimes we don't talk about indeed enough. The Hospice at Home program, as I mentioned, led by Fiona Onslow, is about the clinical and medical support and the care coordination. If I might, Deputy Speaker, just talk about, how is your death literacy? Dying to No Day, of course, is in August, but did you know only 5% of Australians will make a plan for the end of their life? Did you know that 45% of Australians will die without a will? Did you know only half of us have told our partners about the end-of-life care we want? Did you know that 1 in 3 Australians know what a shroud is and how it is used? Did you know almost half of us would like to know more about do-it-yourself funerals? Did you know 60% of Australians choose cremation? Have you ever considered that there are alternatives? Did you know only half of us get to die in our preferred place? Deputy Speaker, in the time left to me, I just wanted to talk briefly about the Hospice at Home program. 70% of people through research tell us they want to die at home. Indeed, the system that has been developed in Tasmania that I think has the potential for a model nationally is about wraparound care. It involves all the service providers to identify gaps in the existing service, the existing services. It is not a new silo service. It's about packages, and in recent times, 44% of the people that have engaged with Hospice at Home have been able to die at home, and that is their preferred. It is about support care. It's about meals, it's about respite, it's about personal care, domestic support. It's about care coordination, keeping people out of hospital, not accessing ambulances as an emergency. The care provided averages about 64 days at home, avoiding presentations, The most valuable thing, I think, is the 24-hour phone services, to where a registered nurse, specialist nurse is available to triage the needs of each client. It is about home and community where support exists and allowing those people to stay in their community, particularly important in an electorate like mine in regional areas. It is a real success program, and I encourage all those interested in this space to understand more about it.